So with a left-on-left sacral torsion, we have to first get on our middle transverse axis because that's the main axis our sacrum works on. And with a left-on-left sacral torsion, the dysfunctional side is on the right. So you're gonna have your hand on the shoulder, so you're gonna get to the middle transverse axis, and then we're gonna wanna convert that middle transverse axis to the left oblique. So then you want to side bend on the middle, so if I side bend here, my thumb drops down. So if my thumb drops down, then I have converted from the middle and I've converted to the left oblique axis. So, and if I side bend this way, my thumb comes up, then I've converted to the right oblique axis. So we're gonna side bend just enough to feel the thumb start to drop down, then we know we're on the oblique axis. So then we want to load the way that the sacrum is looking. So in a left on left, the sacrum is looking to the left. So we're going to load the left ischial tuberosity, and then we're going to side bend back to the right, just to the point that we can feel all the motion under our thumb, making sure we're still on the oblique axis. And then we're going to load an activating force. Again, think of imagining trying to get your hands to touch until you feel the tissue start to activate. And then that's the amount of tension. Each time that you load the activating force, it's going to be a different amount for each patient and each dysfunction. So always match the tissues till you feel that the tissues start responding, and then maintain that. Reach the little still point there, and then we're going to come around. Sometimes the innominate will pick up and release with it because it's all connected there at the sacroiliac joint. And then when all the tissues soften and stop, then we've at the end, and then we can recheck our diagnosis. Again, 30 seconds or less, you should be able to maintain getting the response and getting a resolution. If the body is dancing with you, again, it usually means you need to load more of an activating force or back up and fine tune. You might be off your axes a little bit. And so the body's trying to unwind and get there, but it can't quite get what it needs. So if it's dancing around with you, just know that the localization needs to be a little bit more.